Here we are at the International Congress of Agorà in Medicine Aesthetic, and so we have the honor of with us Dr. Maurizio Cavallini.
Welcome.
We are very pleased to have you here, and we want to talk about complicants. Which are the problems of the aesthetic medicines?
So we know that there is a lot of increasing numbers of patients who are involved in our aesthetic treatments, and so I think that it's possible that we have more complications now in the next future. So I believe that knowing which are the possible adverse events, it's easier for us to take care of them and to help our patients with these possible problems.
You are a director of a specific center regarding this matter in Agorà. How do you work in team? How is it?
So I was very happy to be the director of this center of complications, because we gather many different colleagues from different specialties, from radiology, from immunology, from ecography lines, and plastic surgery, aesthetic medicine. I think it's important because when we have an adverse events and complications, it's important to see the patient under different profiles and different views. So we can support our patient in case of adverse events, and we can also support our colleagues who have this type of problems, because normally we are used to do a complication of the complication. So it's important to take care of them, and we offer this type of service in Milano.
We have in a scientific matter simple and complex complications. How can we approach them?
All the patients must know that we can have side effects. That means the normal reaction that we have at an injection, like bruising, redness, erythema, and so it's not a problem for this one. But sometimes we have severe adverse events. That means that we can have an involvement of the skin, and we can have necrosis, or we can have asymmetric results. So we must take care of these type of complications because we have to know how to solve them.
So do we need more training?
Absolutely, yes. I normally say that our knowledge is one of the most important things. And I believe that the knowledge of anatomy, knowledge of brands, knowledge of products, and how to use them is very important to avoid or to reduce the percentage of complication. In Agorà, we normally do a lot of trainings, and we have a specific course on complications in which we can show to our colleagues which are and how to manage them.
And why the guidelines are very important?
I believe that now we are on evidence-based medicine. So we know that there are national and international guidelines, and so it's important to follow these guidelines because we can follow the right steps to take care of the patients, of the procedures, and even so also of the complications.
Do we need an empowerment of the patients?
Absolutely, yes. I believe that we have to clarify and to explain to our patients all the rules, all the procedures, all the side effects, all the complications, because I believe that now we are going to the next future in which we must be scientists, and so it's important every time to involve our patient in our treatment, also before explaining them all the procedures.
In your center you need a scientific approach and synergy, and you discussed regarding clinical cases.
So in the session that I have the honor to organize here in Agorà, I invited many national, international speakers, and we would like to share which are the most important complications and how we are able to take care of them. And so it will be a pleasure for me to share also with all the attendees, and also with my speakers this session, because I think it's very, very important.
So we thank you very much, Dr. Maurizio Cavallini, and we know that complicants now have some answers. So let's keep in touch.